Watch out for these 3 Medicare myths that could lead to big Medicare mistakes. Welcome to Retirement Revealed. I'm your host, Jeremy Keil, and we're here to turn your retirement savings into retirement income. Today, we're talking about 3 Medicare myths that can lead to big Medicare mistakes. And of course, it's not just Medicare where you can make retirement mistakes. I've got a new resource out. Go to avoidbigretirementmistakes.com. Download my guidebook about the big retirement mistakes to avoid. Well, we're talking about Medicare, 3 Medicare myths. And I came upon these listening to a presentation from Melinda Keil from the i65.com. It's a Medicare resource. And I ordered a book that she mentioned called Medicare for You, written by her mom, Diane Omdahl. So you got a mother-daughter team that are just kicking out some great Medicare information. Read through this Medicare for You book. Great info. I'm going to ask you if you want this book. First 3 people who email me, podcast@keilfp.com, I will send you out the book here by Diane, Medicare for You, A Smart Person's Guide. The top says, save money, save your life with this guide on there. So email me if you'd like to have a copy of that book. I'll put a link in the show notes for that book too. You can get that on your own. But Melinda, I was watching a presentation from her, talked to her afterwards, just thanked her for great info she shared. And again, she's with the i65.com Medicare education platform. She shared these 3 myths, and everyone she said, I thought, yeah, that's it. I've heard people tell me this all the time. Myth number 1 is that Medicare is free. Medicare is not free, and yet 72% of Americans believe it is free. They're quite often surprised when they get to 65 or whenever it is they sign up for Medicare. And yes, the Medicare Part A, hospital insurance, you go to the hospital, Medicare, that part is free if you got that signed up. But the Part B, the doctor, that has a cost. Right now, it's basically $175 a month is what the Medicare Part B premium cost is. It's quite often that's a complete surprise. You think I've been paying taxes for this? Why does it cost me something? Well, the Medicare system is designed from your taxes to pay something like 80% of the cost of it. Well, you're on the hook for the other part, the 20%, including that premium. You got to pay that premium to help pay for Medicare. So don't be surprised when you hit 65 and Medicare costs you something. So if you're on Medicare Part B, as you most likely will end up being, it's $175 a month. Although there's myth number 2 that everyone pays the same for Medicare. Roughly half of Americans believe this, just enough to make it a myth. Surprised actually that half knew about this, 49%, 0.5 or whatever, that yes, actually, if your income grows over certain dollar amounts, you will pay extra for Medicare. And it is surprising because if you have a higher income today, this year, it's 2 years later where it affects you. So we're going to talk about that a little bit. One part is that when you are someone that gets that notice, gets that letter saying you got to pay extra for Medicare, you might be freaking out thinking, oh my goodness, I got to pay extra Medicare for the rest of my life. You don't. It's just based on that 1 year that happened 2 years ago, and it's affecting this one particular year. Another thing that people are asking me all the time is, well, why are they using 2 years ago? Well, think about when you file for last year's taxes, right? Last year happened, you're filing in April, but your Medicare for this year, you have to start paying in January, right? The government doesn't know what your income is this year. They don't even know what your income was last year until April, maybe even later, depends how long processing took on there. But they do know what your income was 2 years ago because you better have filed that tax form by that time, right? A year and a half earlier. So they have to take what they have, which is your income from 2 years ago, and apply that to this year. And you might be above those limits. Those limits for 2024 are at the $206,000 if you're a joint couple, $103,000 if you're single. And actually, there's more from there. I'll put some more info on that. I'll make a note here that we'll put a list in there exactly what those extra costs and the extra kind of, I don't know, brackets is the right word, but the extra triggers. That's probably more of a surprise that than even if you had to pay for Medicare. Oh my goodness, I get this bill and it's extra. So thankfully, it won't last forever. It's only based on the 1 year of income 2 years ago affecting this year. And there are a lot of ways to get out of it. If you had a great year and you just had some great income, well, that doesn't count. You got to pay your extra for Medicare. But there's a lot of times where you retired and you were living a good income when you were making that income, but you hit retirement, you got a lower income. You can ask for an appeal. They call it, I think waiver is the better term, but they call it the appeal. And so it's called the request to lower an income-related monthly adjustment amount. We're helping folks all the time on here. I haven't found too many times that anyone got their appeal rejected, as long as you actually fit the rules. And those rules are, things happen. You get married, that changes your life. You get divorced, your spouse has died, you stop working, or maybe your hours get cut. You lose income producing property. That doesn't mean you sold your income producing property, like something really bad happened there. You lose pension income, or there's some sort of employer settlement where somehow you got an extra amount for 1 year that you're not getting for the rest of time. There's these life-changing events. I'll put that in the notes as well too for you, because that's a surprise. I hear so many people, they say, yeah, last year I had to pay so much extra for Medicare, and I asked them a little bit more about it, and it turns out it was too late. They should have maybe given me a call or start working with me ahead of time. But we've helped dozens of people with these requests to lower, because things happen. You hit retirement, your income changes, people die, income changes, and you want to pay the right amount for Medicare. So all is not lost if you get that notice that you have to pay extra for Medicare. And now that you know about it, you can plan ahead for this. We often look at what happens when there's two of you going down to one of you, and your income quite often is not above that 206,000 trigger to pay the extra, but quite it could be where it's above the 103,000 to pay the extra if you're single. So if you're married, you might be wanting to pay taxes on purpose, right? You get the traditional to Roth conversion, so that later on when somebody's single, they have a lower required minimum distribution. And if they want to take money out, it could be Roth tax-free. That way they're not triggering those extras for Medicare. So think of this IRMA, this extra cost for Medicare, in your retirement planning. Well, the third myth that I hear all the time, and 72% of people believe this as well, according to Melinda Keil from I-65, is that Medicare covers long-term care. And that is just not the case. Medicare will cover some stays in the nursing home, but it doesn't cover most stays in the nursing home. The easiest way to think of it is this way. If Medicare thinks that you are going to get better, if they think you're going to recover, this is a short-term thing where, okay, you had a surgery, you got to go to the nursing home for some sort of recovery, that is what they would cover. And there's limits on that, something like 90 days that they would cover at the most. It is there for short-term situation. But if you have what you normally think of long-term care, which is, okay, I've got, my health was doing well, but it's just declining. I have trouble taking care of myself. My memory is having some trouble. I need some long-term care. Medicare does not cover that. The only thing that covers that is your own money or your own long-term care insurance policy, or it could get to the point where Medicaid, the government, comes in through Medicaid, and they are paying the cost of long-term care. But Medicare itself does not cover long-term care. So as you're preparing for age 65, as you're preparing for Medicare, remember that Medicare is not free, and you might actually be paying a higher cost because of your income. And Medicare does not cover long-term care expenses. Keep those three things in mind as you are planning for your retirement, as you're planning out your retirement. Give me a call, give me a message, go to retirement-reveal.com. Top right corner is Ask Jeremy a Question. Happy to answer any of your Medicare questions. And of course, the first three folks that asked me for the book, I will send out that book to you, the Medicare for You book. Thank you for Diane writing this book, for Melinda. Great presentation I saw at the Financial Planning Association, sharing her wisdom that I agreed with about these three Medicare myths that absolutely can lead to some big Medicare mistakes. Thank you for listening to the Retirement Revealed podcast. We believe if you know more about your money, you will feel better about your money and you will make better money decisions. Hi, I'm Jeremy Keil, owner of Keil Financial Partners. And if you're interested in seeing how we help our clients get more income, pay less in taxes, and avoid big retirement mistakes, make sure to go to keilfp.com. That's KEILFP.com.